Hi everybody, my name is Rebecca Medansky. I'm a pelvic floor physical therapist and the owner of Ladybird Physical Therapy. If you're new to our channel, welcome. If you are not new here, welcome back. Today we're going to be talking about C-section scar massage. And this is part 2 to a 2-part series about C-section scar care. So if you're watching this video and it feels like way too much too fast, look at our previous video on C-section scar desensitization. It's a gentler approach to addressing scar sensitivity postpartum. If you already watched that and you're ready for something a little bit more, scar massage might be right for you. Today we're going to be talking about what scar massage is, why you do it, and then I'm going to be showing you some techniques so that you can get started. All of that is to say, or all of that before we get started, what I should mention is that if you're earlier than 6 weeks postpartum, it is probably too soon for you to be getting C-section scar massage. It is not appropriate to begin scar massage until the incision has healed fully, which usually happens at the earliest around 5 weeks or so. 6 weeks is typically when you're cleared by your physician, by your midwife for physical activity, for intercourse, for all of those things. That's typically around when we want to start scar massage as well. And if you are having redness, swelling, increased pain in the area, please contact your medical provider. And again, if anything that I'm walking you through today seems like it's too much or does not seem like it's the right fit for you, remember this isn't medical advice, and you can always reach out to a pelvic floor physical therapist for more one-on-one guidance for personalized care. We work with people virtually all over the world. We work with people in Austin, Texas, in our local or central Texas, in our Austin-based clinic. So keep all of that in mind. But now that all of those disclaimers are done, let's get into C-section scar massage. So scar massage can be done at a cesarean scar, can actually be done on any scar on the body. The thought behind scar massage is that scar tissue is different than the rest of our skin. Scar tissue is a little bit less stretchy, it's a little bit stiffer, and it's thicker. So scar tissue gets bound down, it can have adhesions, it can cause discomfort just because of the tightness in the area and the tightness in the muscles surrounding the scar itself. Now, when we're talking about a cesarean scar, it's important to remember that the scar is not just on the skin. Your cesarean scar has sutures through the deeper layers that were cut through in order to get baby out. So when we're doing C-section scar massage, it's important to use moderate pressure so that you're not just moving the skin around. That's one common mistake that I see people make. It's also important to remember that this should never be terribly painful. This should feel moderate at worst. If you're having significant pain during or following, then this might not be right for you for whatever reason, and again, more personalized care might be appropriate. But if you're feeling good and you're ready to get started, then we're going to go through some techniques. Now, some reasons that you might want to use C-section scar massage. One would be if you have pain or sensitivity in the area past that 6-week point. So your incision has healed, but it still feels really sore and achy, or you're uncomfortable pressing up against the surface, or it's uncomfortable when your baby kicks you in the stomach. Those are all signs that C-section scar massage might be helpful. Another reason might just be if you feel tightness in the area or tightness in your pelvic floor. If you're having pain with sex, whether you're a few months or a few years postpartum, a C-section scar and restrictions through the abdomen can be a contributing factor. Other reasons why you might want to consider C-section scar massage is if you have that C-section shelf in the abdomen. So if you feel like your tissue is pulled in at the scar, those are all signs of adhesions or thickness or stiffness in the scar itself. Now that we're done through all of that, typically when you do C-section scar massage, you want to be laying down and you want to have coconut oil or lotion. I'm going to be standing up to demonstrate today because it's easier to film, but you want to make sure if you're doing this at home that you're laying on your back supported on pillows so that your belly can be fully relaxed. You don't want to be gripping through your core when you're doing C-section scar massage. And I typically recommend using something like coconut oil or olive oil because it doesn't absorb into the skin too quickly. But if you have a lotion that you prefer, that is fine as well. So let's get into it. The first thing that you're going to want to do is take some lotion, expose the scar, and put lotion along the whole belly. Now you want to lotion all the way up to the belly button, all the way down to the pubic bone, really this whole area because you can kind of work throughout. But we're going to go through some basic C-section scar massage techniques. Again, you're laying down on your back, belly is relaxed. You're going to use these 2 fingers. And the first thing that we're going to start with is putting fingers right on the scar and just going in circles. And what you want to feel is, how does the scar move? Does it move under your fingers? Does it feel like you really have to pull it? Is it really a limited range of motion? You want to go clockwise and counterclockwise. And you're going to do this along the entire scar. You're going to go from right to left. You're going to do 10, 20 circles in each spot before you move on. Again, I'm going a little bit faster. You're going to do 10 to 20 circles along each spot as you move along. Using moderate pressure, this is not enough. You do need to apply some pressure. Now, if it's really painful, back off. Again, it should never be terribly painful, but moderate pressure so that you can really feel that tissue move, and you're going to go all the way across and then all the way back. Now, that is one technique. If that's enough for you, pause there, that's fine. If you're ready for more, our next technique, you're going to apply those second and middle fingers, and you're going to pull up and down along the scar. So this is a bit more of a shearing force, right? This might feel a little bit more intense. You might not feel comfortable with this when you first start. It will likely get easier for you. And again, you want to go 10, 20 times all the way across the scar, all the way back. If that is still feeling good for you, you can also just do gentle lifting and pulling. Just hold. If one direction feels more uncomfortable for you, you can pull up and move around. Again, moderate pressure. I am compressing. You're not just doing a light touch. You are pushing in to do this. It should be a little bit uncomfortable. Again, not terribly uncomfortable, but a little bit uncomfortable is okay. Now, if all of that feels good for you, there are a couple other more intense techniques you can try that I do not recommend until maybe closer to 10 to 12 weeks postpartum, once the scar looks really good. One of these is a distraction technique where you want to pinch and lift and move the scar around. You might find that different parts of the scar are harder to pinch and lift, but you're pinching and pulling away. It's a little bit difficult for me to show you from the side, the pinching and pulling and lifting away. And again, you can just hold if that feels intense, or you can move up and down. You can also roll the tissue between your fingers. So to recap, we have circles, we have shearing up and down, we have lifting up, down, pulling, angle side to side, and then we have pinch and lift. All of those are great scar massage options. You can do them for 5 to 10 minutes a day, a few times a week. It should never, again, cause severe pain, but you might be a little bit sore afterwards, and for a day or so, you don't want to do it again if you're still really tender. And if you feel like you need more guidance, or you're having a really hard time doing this yourself, please consider contacting a pelvic floor physical therapist who can both help perform the manual therapy for you and teach you some techniques that might be more appropriate for you. Either way, thank you for joining me. I hope you have a wonderful day, and we'll chat soon.